Welcome everyone to the Canadian Nurses Association's webinar series, Progress in Practice. This webinar is called the VEGA Project, Supporting Nurses in Addressing Family Violence. This session is being recorded for nurses who are unable to participate today. My name is Aiden Hamza, and I'm a policy advisor at the Canadian Nurses Association, and I will be hosting this webinar. At the end of the presentation, we will answer your questions, which you can type into the Q&A box that you see in the right of the slide. We will address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenters, Karima Velji and Harriet McMillan. Karima Velji holds the position of Vice President of Clinical Services at Ontario Shores, a Centre of Excellence for Mental Health Care in Whitby, Ontario, and she is the current co-chair of Health Canada's VEGA program. Karima's responsibilities extend to provincial and national leadership, including past president and chair of the Board of Directors of the Canadian Nurses Association from 2014 to 2016. She also has cross appointments to the University of Toronto, University of Western Ontario, University of Ontario Institute of Technology, and Nipissing University. Our second presenter, Harriet McMillan, is a psychiatrist and pediatrician conducting family violence research and is the lead for the VEGA Project. She is a member of the Oxford Centre for Child Studies, a distinguished university professor in the departments of psychiatry and behavioral neurosciences and of pediatrics at McMaster University. Harriet's research focuses on the epidemiology of violence against children and women and is funded by organizations such as CIHR, the CDC, and the Public Health Agency of Canada. Her work in the area of family violence has been recognized with an appointment as a member of the Order of Canada in 2016. And now I'll hand it over to our excellent presenters.
Good afternoon, everyone. This is Karima speaking. Thank you, first of all, to all of you for joining the webinar today in a very snowy country, I think. I'm speaking to you actually from Punta Cana. It's very warm and lovely here, so I can't tell you how glad I am that this connection is working today. It's been such a pleasure for me to have been invited by the leaders of the VEGA Project to co-chair this work. I'm so glad that Harriet was able to join us today to walk us through the work we've done and the resources you can use as nurses. My interest in this work is both personal and professional. Personally, I have witnessed issues of family violence in my own extended family and have seen the issue normalized and buried within many cultural communities, including mine. I can tell you that the consequences of family violence are profound, lifelong, and intergenerational in nature. I stepped in to be the co-chair of the work of VEGA when I was president of the Canadian Nurses Association. I believe nurses are best situated to encounter the issue due to our large numbers, but also the many practices in which we work. You will learn that 30% of women will be exposed to intimate partner violence in their lifetime, and family violence does not discriminate. Nurses are the first point of contact for many patients and families, and I think we need to be able to recognize the signs of family violence and to respond appropriately. I think you will find the resources of VEGA very, very helpful to you, as they are very practical and very applicable to practice settings. Lastly, I'd like to thank Health Canada for their vision, their commitment, and for their ongoing financial support for this work. And I'll now hand it over to Harriet.
Thanks very much, Karima. And I'd also like to thank Elizabeth and Aiden and the Canadian Nurses Association for giving me the chance to speak today about VEGA. As well, you will be hearing from a colleague of mine, James Dietrich, toward the end of the presentation. James is with the Computer Services Unit at McMaster University, and he's actually going to be walking you through VEGA, and we're very excited to show you these educational resources. I would also like to say that we're so grateful to the Public Health Agency of Canada, in particular members of the Family and Gender-Based Violence Prevention Unit, Mental Health and Wellbeing Division with the Center for Health Promotion, for all they have done in contributing to the work of VEGA throughout the project. Next slide, please. So just to say that other than the funding for this project from the Public Health Agency of Canada that McMaster has received, I have no other disclosures. Next slide, please. So I'm going to take you through the objectives one by one. So first of all, we're going to be showing you a video, which in addition to addressing the question of why VEGA, talks about family violence in Canada. Secondly, for the next objective, we're going to be discussing the background to the VEGA project, and I'll give you some information about how VEGA came into being and the foundation of VEGA, which is very evidence-based. And then the third objective that we plan to do today is, again, to show you some of the actual resources. And I'm going to give you some examples from my own clinical work of how I hope VEGA can be useful in the practice context. Next slide, please. So let's talk about, first of all, how VEGA came into being and what was the need for VEGA. So VEGA is for healthcare and social service providers to assist them in recognizing and responding safely to family violence. I will say family violence is a big area, and in particular, VEGA focuses on three main types of family violence: child maltreatment, including physical, sexual, and emotional abuse and neglect, intimate partner violence, and children's exposure to intimate partner violence, which is also considered a type of maltreatment. So these are the areas of family violence that VEGA focuses on. Of course, there are other types such as abuse of older persons, or what is sometimes called elder abuse. But again, the emphasis on those types of family violence for VEGA really came about through discussions with the Public Health Agency of Canada, as well as the Minister of Health's office at the time. The Minister of Health, when VEGA began, was Rona Ambrose. And there was a recognition that for many healthcare and social service providers, that they actually didn't receive any training about how do you actually recognize, how do you actually respond to family violence in a practical sense. And the other issue that came up is, thinking through family violence, asking questions about it, knowing how to do more good than harm. Those are complex issues. How can we possibly have the time to do that in a busy clinical setting? So these were some of the factors that led to VEGA being created. And again, just to emphasize, VEGA is the work of many, many people coming together, practitioners, policymakers, researchers, students. And if I take you to the next slide, you'll have a sense of the broad range of organizations who've been involved with VEGA. So you can see listed here 22 organizations. These organizations were invited to identify representatives to participate in VEGA from the very beginning. And I think that's such a crucial point in VEGA's success. So they were invited by the federal health minister at the time, Rona Ambrose, and you can see highlighted Canadian Nurses Association And we're very grateful to the individuals who participated. So at the very beginning, Lisa Ashley and Megan Manning were involved. And more recently, we've had Aiden Hamza, who you've been introduced to already, Carrie Schuhendler, and Judy Waldman. And we're so appreciative of everything that they've brought to this project. As well, we were so fortunate to have Karima in the role as president of the Canadian Nurses Association when she joined as co-chair of what's referred to as the National Guidance and Implementation Committee. So again, really very grateful to the Canadian Nurses Association. So you can see that there are a whole range of organizations here. And some people might ask, well, where's education, or where's justice or police? And it was really felt that we needed to start with healthcare and social service providers. And so that's been the emphasis for VEGA. Next slide, please. So now what we're going to do is show you a video that talks about how huge a public health problem family violence is. Just to say that this particular video is available through the VEGA website. Due to some of the weather challenges today, parts of this presentation are not happening in the office with the optimal sound, but hopefully you will be able to hear about the very important components of VEGA. This really summarizes it, and then I'm going to expand on some of the points in the video. So if we could start the video, please.
Hi, I'm Maria. I'm a family doc. I think I'm pretty compassionate. You know, I read the literature and keep up with what's new and the best practices for my patients.
And I'm Mark. I'm a social worker. It's important to support my clients and advocate for their needs. That's why I was so surprised when I became more aware of the huge impact of this one exposure. This kind of exposure is linked to all kinds of mental and physical health problems like depression, anxiety, alcohol, and drug use.
In children, it can affect how brains grow and develop. It can lead to all types of problems across their lifespan. In adults, it actually increases the chances of heart disease, cancer, and other chronic illnesses.
It's not a toxin or a virus or a pollutant. It doesn't discriminate. It can affect everybody across all cultures, communities, and income brackets. The kind of exposure we're talking about is family violence. Family violence is a complex issue, and every Canadian family is susceptible. The numbers are staggering. About 1 in 3 Canadians has experienced abuse before the age of 15. A Canadian woman is killed about every 6 days by her current or former partner. We're becoming more aware that men are at risk as well. Transgender people have a much higher rate. Over 60% reporting experiences of intimate partner violence, or IPV. You may know IPV as domestic abuse or domestic violence.
There are lots of different words used to describe family violence. With children, it's often called child abuse and neglect or child maltreatment. Another type of family violence is called children's exposure to IPV. It involves a child hearing or seeing violence among caregivers or being aware of its effects without actually witnessing it.
Whatever you call it, research shows that physical, emotional, or sexual abuse and neglect can impact all aspects of a person's life, including how they learn, speak, behave, and interact with others.
When I read about family violence, I realized there was more to it, and I really needed to learn a bit more about this. I found a great resource called the VEGA Project. VEGA has created evidence-based guidance, a handbook, and innovative educational resources about recognizing and responding safely to family violence. It's the first time that national organizations, including nurses, dentists and dental hygienists, doctors, child welfare advocates, and a range of others, have come together to develop ways of helping people know how and what to say and do to help patients experiencing family violence. Also, what not to do. This type of violence is not always obvious. In fact, it's often hidden. Most importantly, I don't want to do more harm. To be honest, I didn't see this as part of my role. I basically view family violence as a personal or social issue best addressed with a referral to someone else. Obviously, if you're losing closure how family violence influences abuse behavior, it prevented me from effectively communicating with my patients. Now that I really think about it, maybe I avoided bringing these sorts of things up because I didn't want to make it worse or shed light on an issue I couldn't handle. I didn't know how to make it safe to address family violence in my day-to-day practice.
The VEGA Project developed an approach called Recognizing and Responding Safely to Family Violence, which addresses those exact concerns. Now, I feel like I know what I'm doing. I'm less worried about causing harm. And you know what? This is relevant to all my clients, not just those affected by family violence.
Very true. It makes me think more carefully about behaviors I find challenging. I used to ask myself, why did someone act like this? Now I try to be more compassionate. So instead of wondering what's wrong with this person, I think about what's happened to this person and start the conversation there. VEGA's handbook helps me to respond to my patients. Now I understand how important it is to create both a physically and emotionally safe environment.
It's encouraging, right? And new evidence is emerging of promising interventions that can help both adults and children investigate acts of violence.
Knowing how to recognize and respond safely and what the appropriate referral pathways are creates a better experience for all of us. When this becomes a part of your everyday practice, your patients are more likely to benefit.
To make this part of your practice, start by looking up projects VEGA.tv. There you can find tips and tools like how to recognize the possible signs of abuse and ways of responding safely. Practical, evidence-based guidance.
The VEGA Project is available to educate and support us to work safely and effectively with those impacted by family violence. VEGA helps us provide the best possible care for our patients and clients. Hi, I'm Maria. I'm a family doc.
So thanks, Elizabeth, for showing that video. And again, just to say to all of you, when you go to that video on the website, you will hear it very clearly. And as I'll go through, I'll be giving examples of how you can use various resources. But for those of you who are educators, perhaps that's a video that you would like to use with your students. Again, all of the resources that we're showing you today are going to be freely available for people to use. So let me now speak about the foundation of VEGA, the emphasis on evidence. So to develop the various components of VEGA, we did systematic reviews taking into account the 3 types of family violence outlined on this slide. And we worked together with the World Health Organization, who at the time we were doing this work for VEGA was developing guidelines for response of the health sector to child maltreatment. In the past, they had done guidelines on responding to intimate partner violence. So we worked together with WHO. They talk about guidelines and they predominantly develop resources for low and middle income countries, where VEGA is really focused on Canada, the needs of Canadians, particularly healthcare and social service providers. And so what we did, again, were these systematic reviews, looking at aspects of recognition, of response, and these are all summarized in what we call guidance summaries. Why guidance and not guideline? Really because we wanted to take a broad perspective. And so in addition to recommendations, we also have good practice statements. There are many elements of care that one wouldn't need to do a randomized trial on to show that it's important. For example, in the case of intimate partner violence, if one is going to be asking questions of an individual, not doing so in the presence of a partner or anyone else where one could put somebody at risk, that's an example of a principle, a good practice statement. So these are the kinds of areas that VEGA has addressed. In addition, VEGA emphasizes the principle of what we call trauma and violence-informed care. You may be familiar with trauma-informed care, but we talk about trauma and violence-informed care to make it clear that we are talking about a form of trauma related to violence. As well, we take a very broad perspective. We want to make sure that what VEGA addresses is, first of all, taking into account that any patient or client that a person is seeing could have experienced in the past or currently some type of violence, and in particular, making sure that we don't do harm, that in some way the system doesn't re-victimize the individual. As well, this needs to be considered in the larger context, taking into account physical, emotional, and cultural safety, as well as equity. So these are very important elements in VEGA. And I'll be telling you more about the modules, but we actually have a module on creating safety that emphasizes those aspects. You'll see over in the right hand of the slide, consideration of the lifespan approach. I mentioned earlier that abuse of older persons in the context of elder abuse is not included, but nevertheless, we know that intimate partner violence extends throughout adulthood. So very much the focus is on the lifespan. Next slide, please. So this is VEGA's learning pathway and content. And we've tried to combine both a clear path for both practitioners and educators to take people through what we think is a logical approach to this. Having said that, we recognize that people are busy and should have the opportunity to go to whatever part of VEGA they want to see. So just to start off with, over on the left-hand side, there is a summary about VEGA's resources. And in that part of the website, the Why VEGA video that you just saw is included. So we really talk about looking at VEGA's resources generally to know what's there. And then certainly what we've seen through research and in talking with people on our National Guidance and Implementation Committee, much of what is currently taught in various schools, for example, nursing schools or social work programs, medicine, is about the epidemiology of family violence, issues like prevalence, risk and protective factors. And that information is important, but we also feel that the practical aspects of recognizing and responding are really often missed in the training that people receive. So the Know About Family Violence in Canada is the module that addresses the type of information that is available in various educational resources. We thought it was still important to have a concise summary of that with VEGA. And then moving to the second module, Learn About Creating Safety, which I just referred to, where we talk about creating safe interactions, creating a safe environment. And throughout VEGA, we have examples, cases, as well as questions. We refer to them as knowledge checks. Then we have a module on child maltreatment, a module on intimate partner violence. We hope that people will look at both, but depending on your scope of practice, you may have more of a need for one over the other. And then within each of these modules is a submodule on children's exposure to intimate partner violence, because we feel that's important with both of these modules. We also have a submodule on the voices of those with lived experience. And this is put together again through systematic reviews. So we think it's so essential to hear from those with lived experience. So these are the learning modules. And again, they have videos, they have links to educational scenarios, which I'll show you. And so there may be a time where after you've gone through those modules, you don't feel the need to go back to the learning material, but you want to say, go in and refresh your memory. Oh, what were those questions that might be helpful as I go and see that patient? And for this, we have the Family Violence Handbook. So here we have this available online, and we also have downloadable printable versions. And then in terms of additional resources, we have PDFs and various tools that can assist you with some of the specifics, for example, around assessing safety, these types of issues. So this gives you the overall framework of the VEGA learning pathway. Next slide, please. And then this shows you an example of the child maltreatment care pathway, and it's also how the module is laid out. So for any component of this pathway, at the top you see understand the limits of your role, create safe environments and interaction. So for each of these sections, there's an expansion with information and interactive approaches embedded in the module. So if you just take a moment and look at these various elements, what we've tried to do, the National Guidance and Implementation Committee was very helpful in identifying what are the areas where people really struggle and that VEGA needs to address. So for example, mandatory reporting. How does one do mandatory reporting in a way that is most respectful to the family? These types of issues. So those points are very much what VEGA has tried to ensure are included in the materials. Next slide, please. So this particular slide just shows you screenshots of the various videos. Now again, keeping in mind that everyone's busy, all of the videos are 5 minutes or less, with most of them being less than 5 minutes. And so people sometimes say, oh, to include questions about, say, child maltreatment or intimate partner violence, that could take considerable time. We show in these videos how it can be done in a way that is practical and feasible. And again, there are a broad range of clinical settings. The videos are there really for people to look at and say to themselves, well, how would I envision myself doing this? And this is actually a good point for me to say that with VEGA, we think the way it is best used is in the context of either a continuing education activity, or for example, within a curriculum where people watch videos, they look at the scripts, they read the material, they have a chance to think about it, and then they do some role playing. So again, this is what we think is the best use of VEGA. Having said that, it is possible to go through all of VEGA on your own and do this individually. And just to quickly tell you, so the types of videos, one is telling parents about the need to contact child protection, because we know that parents do best when they're advised as to what's going to be happening and are treated with respect. And then it also shows how to speak with young people, because one of the areas we heard about is people said, well, we don't actually know what questions to include when we're talking to young people. Next slide, please. So this is another example of an interactive component of VEGA. It's an educational scenario. It allows one to go through and make choices and get feedback about your choices. So again, could be done individually, but really best done in the context of a discussion where you can work through and actually look at what happens depending on what you choose. So in this particular case, you don't hear the voice of the provider, which is you as the observer, but you hear the voice of the patients and clients. Next slide, please. And earlier, as I showed you the pathway for child maltreatment, now this is the comparable pathway for intimate partner violence. So again, you can see at the top, creating safe environments and interactions, being alert to potential signs and symptoms, and the various elements of what we think is important in the safe interactions with patients and clients. So for each of these elements, they are expanded on in both the module with further interactive components and in the handbook in a concise way for you to get additional information. Next slide, please. And just as we had videos with the child maltreatment topic, we have those with intimate partner violence. This shows you some screenshots of those videos. There's a knowledge check over on the right, just an example. And then we have what we call scripts or statements. Again, they're examples of what people can say in the context of having a discussion about intimate partner violence. Next slide, please. And here is the educational scenario for intimate partner violence. We actually have 3 interactive educational scenarios. This is the second, showing individuals in an emergency department. So one of the challenging issues that came up that we heard about from the National Guidance and Implementation Committee is what happens if the partner will not leave? And so this again was flagged as something that VEGA needed to address in the materials. Next slide, please. So what I'm going to do here is just give you an example how, as a clinician, I, well, in fact, have used the resources of VEGA and might use them. So this is a video that basically shows a clinician assessing risk after hearing information indicating that the patient is experiencing intimate partner violence. And so let's say I was going to be seeing a patient in the next few days that I was concerned about and wanted to refresh my memory about, okay, I just want to go over again how I ask those questions, and I want to make sure that I think through the different possibilities. So one could go in and watch the video, or having watched the video, you could go to the handbook and look at, okay, I'm just reminding myself of the types of questions that I can ask. So this is how we hope that VEGA will be used. And then the next slide. So here we have a screenshot where there's a discussion between a nursing student and her supervisor. And in this case, the nursing student is seeing a mom who comes with an infant whose diapers are soaked in urine, and the mom is asking the student for additional diapers, and the nursing student is thinking through, you know, should I be thinking about neglect? And what the supervisor does in this particular case is walks the student through thinking about the case in general and identifying, in fact, that there are issues of poverty, that there are issues of physical disability, and helping the student think through her processing about this. So that, and again, we have questions that we hope people can use in an educational sense. So this type of video I find would be hopefully useful in, say, a teaching setting where, again, people have the opportunity to think through the social determinants of health. They think about the importance of a trauma and violence informed approach. And again, I don't want to give anything away, but you can imagine that what starts off where someone thinks that this might be neglect, in fact, may have a very different picture to it. So here, in circumstances where I'm working with students and residents, this is the type of video that I would go to, you know, as an example. Again, hopefully it's also helpful with practitioners, but what I've tried to do is just give you examples of how the VEGA materials can be used. Next slide. Now, this gives you information about how to register for VEGA's family violence resources. And again, we really hope that you will use them and let us know what you think. We want to make VEGA the best it can be. We want to make it accessible and practical and useful. I'm now going to turn this over to James Dietrich, who is going to do a quick demonstration for you of the VEGA website, really highlighting different points that you might like to know in relation to how the website works.
Thank you so much. So I'm just sharing a live screen of the website here, and I won't take more than a few minutes, but there's a couple points that are good to know. And one of the first things, I saw some things flashing to the chat. Where do I get this video? Where do I get this? It's great to see so much enthusiasm. And the good news is it's a single point of contact. VEGA Project. .mcmaster.ca is where you can always go to start, and that video that everyone wants to see again with better sound is right there on the homepage. This is where you can go to get information about the project, also where you go to start your journey through the educational resources. So you can see after you've watched the video, you can register here or log in if you've already registered. Registering is very, very simple. It's a very simple registration form. It's basically first name, last name, email, and you can self-identify optionally as a particular healthcare provider, social service provider, just for demographic purposes. After you've registered, you receive an email with your login instructions and password, usually within about a minute, if what I've done is working well, and then you have access to the resources. So here I'm showing the actual resource website. So we've already logged in, and please notice that your homepage is laid out exactly like that VEGA learning path that Harriet showed you. If there's a take-home message about how to interact with the website from a technical sense to enjoy your experience and have success, it's really is start here. Although we recognize that you want to move through the resources however you see fit, if you start here, it will manage your expectations about what it is you're going to see, how you're going to see it, how you get help if you need it. So it is really kind of a great place to start. From there, you can navigate through the various modules of knowing, creating safety. I'm jumping straight into intimate partner violence. Normally it would say, hey, are you sure you want to jump straight to this part? But for purposes of brevity today, I'm jumping right here. And as you can see, it's laid out very simply and in a nice logical order for you. Here's some learning modules, which Harriet referred to. Here's those educational scenarios. And everything always ends with a how do I move forward from here? How do I continue my learning? Well, we tell you, you can proceed to here, or you can explore additional resources, or you can review the handbook, so that at all points you're always guided through your experience. You can see that we do have a lot of those additional resources available for you. Here's an example of a PDF for some key messages. Everything is on brand, everything is printable, so that these resources can very easily be produced in a very attractive, readable format, okay? I'm going to now jump in. This is an actual learning module. So once you've navigated in and actually started your module, I just wanted to point out, because people who have seen this early stages are going to end up being emissaries. You know, I tried it, but how does it work? Every module starts with a technical introduction, which is sort of like, okay, here you're going to see text, you're going to see videos, here's how they work. But after you've gone through this once, there's always an opportunity to skip directly to content. And then the content guides you along that pathway, just as Harriet has shown you, with liberal uses of stop points to check your knowledge or get key information back. So as long as you continue on, it'll just take you along the pathway. The system remembers where you are, so if you leave and come back in the future, you won't lose your progress or have to remember, where was I? An example, I'm not going to play through it all again, but as was pointed out, here's one of those educational scenarios. You can see I'm clicking quickly through simple visual instructions, which again are provided. The idea here is that while it's best to go through these in a curriculum or with guidance, if you're doing it individually, you're still being supported all along the way, okay? Last thing I just want to point out is, you know, it is optimized for computers. You can use it on a mobile phone, you can use it on a tablet, it works. You have a bigger screen, a better experience on a larger one. What do you do if you need help? Okay, so if you're, I just wanted to point out, top of the screen, contact and help, bottom of the screen, contact and help, single point of email address where you can always point to. This email address doesn't go to a big group of hundreds of help desk workers. It goes to key individuals who are very familiar with the resources and who are invested with you using the website successfully. So while you won't get live chat 24-hour support, you will get conscientious, well-considered support, which will help get you back online and learning and achieving your goals. Okay, I just wanted to step through those critical things. I'm going to stop sharing my screen now and turn it back over.
So that really gives you what we hope is an overview of the VEGA Family Violence Education resources. And I'm delighted to tell you that VEGA went live yesterday. So this is available to all of you through registration, as James just talked about. And again, we really hope to hear from you, you know, about how you find using the resources and how you think it can be improved. We want to make sure that this is something that I was going to say doesn't sit on a shelf somewhere, but I guess I should say doesn't sit in a computer somewhere, and really gets used to help healthcare and social service providers recognize and respond safely to family violence. So at this point, I'll turn it back to Aidan. Thank you very much.
Thank you, Karima, James, and Harriet for the excellent presentation. Before we move on to the Q&A period, we'd like to ask that participants answer a couple short survey questions about today's webinar. So they should appear on your screen now. We will now start the discussion portion of the webinar. If you haven't already, please type your questions into the Q&A text box. So we do have a question that's already come in, so I'll point this to our presenters. From Catherine Ann Miller, congratulations for academic institutions such as integrating VEGA into a nursing curriculum at the university level. What costs would be expected? Do students need to register as individuals?
So first of all, Catherine Ann, thank you so much for that question. And I hope I'm not embarrassing you by acknowledging you as a reviewer of VEGA. And just to say that we have acknowledged people who have spent a lot of time reviewing VEGA and getting us to this point. So again, thank you. There is no cost to individual use of VEGA or organizational use of VEGA. The only potential cost that would be involved, let's say the Canadian Nurses Association wanted to receive information about people going through VEGA for tracking purposes so that they could issue a certificate. We do have the capacity at McMaster. This has all been carefully laid out. We have a privacy policy that you're welcome to read online. But basically, if organizations wanted McMaster to be able to gather information that will assist them through various curriculum opportunities for that additional work at McMaster, there would be a cost associated with that. But for any of these materials, any of their use, there is absolutely no cost, and that's something that we felt was extremely important.
Thanks, Harriet. The next question is related to the materials and guides. It states, are there hard copies of materials and guides, etc., available?
So we do have PDFs on the website. You know, for example, the handbook, the various tools that James was showing you. I mean, certain parts of the materials don't lend themselves to downloadable components, you know, such as obviously the games or the videos and therefore the modules, because those are embedded in the modules. But all the crucial information, the text, for example, that is included in the handbooks, and those are downloadable.
And just to clarify, Harriet, will they be able to order hard copies from VEGA, or is everyone printing them off independently?
They would be printing them off individually, Aiden.
Perfect.
But again, I would say, like, along the way, if somebody said, you know what, I'd really like to have a hard copy of some of this material consolidated in a way that is even more compact, the VEGA team here at McMaster University would be open to considering that.
Fantastic. Our next question is related to certificates. It states, do VEGA learning modules come with certificates?
So with the participation of the National Guidance and Implementation Committee, we had a lot of discussion about this, and actually, you know, Karima has a lot of expertise in this area. So maybe Karima, after I answer this question, please jump in. But basically what we've tried to do is make VEGA accreditable. In other words, it's ready for accreditation such that an organization could issue a certificate. Since with these 22 organizations, there's a lot of variation in what people expect and different levels of competence, for example, in going through a module. We thought it was important that the organizations decide on that with a certificate. Now, if an organization would like assistance in creating what's needed to give a certificate, let's say they would like assistance in creating a particular questionnaire or something like that, again, this is where the VEGA team at McMaster is happy to help.
What I would add to this is we also reached out to organizations such as Accreditation Canada to see not only accreditation in terms of education organizations providing certificates, for example, of participation, but also organizations like Accreditation Canada embedding the VEGA curriculum into the standards of care, basically, so that when organizations are accredited, these content, the VEGA content, is also taken into consideration as well.
Perfect. Thank you, Harriet and Karima. The next question, I think we have time for a couple more questions. The next one is related to a roadshow. Are you doing a roadshow on VEGA? I work at a community health center and would love to have you come and do lunch and learn.
So it's Harriet here. I can say that we have a team of people that are happy to do road shows. And we think that coming to a lunch and learn is exactly the kind of setting where VEGA is best discussed and really reviewed together. So absolutely, we are happy to do that. Some of the practitioners that were engaged in developing VEGA have made themselves available, and we're eager to do that. So thank you.
You can count me in as well. In any of the lunch and learn or education sessions you want to offer. I think people like Harriet are best to provide the content because they are practitioners in the field and researchers. But for me to be able to champion this in any of your education sessions, to really kind of bring healthcare providers' attention to this content, I'd be more than happy to participate in anything like that.
That's fantastic. And I would just point the participants to the contact information that's available on the screen now as well. Our next question states, would you say that the resources are applicable to both female and male and other identified gender victims of intimate partner violence?
So thanks so much for that question. In fact, we've tried to be very careful in VEGA in making sure that this applies across genders. So, for example, in the intimate partner violence module, sometimes there can be, understandably, given the morbidity and mortality of violence against women, a real emphasis on that aspect of intimate partner violence, which is so important. But we know that intimate partner violence occurs across genders. And so that is emphasized in VEGA. When it came to the systematic reviews, in terms of the scientific literature, much of it focuses predominantly on violence against women. So what we've tried to do is indicate where that's the case. So we're clear about the evidence and the groups that it's referring to, but throughout VEGA, we've also tried to emphasize principles that apply more broadly. That's another element, and I really appreciate this question being raised, that we thought was very important for VEGA, and similarly in the child maltreatment module.
Thanks, Harriet. And the next question states, do you have built-in questionnaires to poll the students about their experience? And how helpful were the modules?
So at this point, what has happened to develop VEGA has been seeking individual feedback and feedback in particular groups. So we asked people to go through the material and provide their feedback generally. We did with certain groups also try and give them some general questions to guide them. I will say that, this will be coming in the future, but we see VEGA as needing to undergo evaluation, and that's in the works. I wish I could tell you more about that right now, but stay tuned.
Perfect, and that brings us to the end of the questions for today. But if you do have any further questions, please feel free to forward them to us. Thank you again, Karima, Harriet, and James for your presentation. We hope this session stimulated your thinking about family violence and the resources available to nurses.
And
you can access.
Oh, sorry, I just wanted to say I'd like to thank everybody for tuning in today, and thanks for giving us the chance to talk about VEGA. Sorry, Aiden, I didn't mean to interrupt.
No, not at all, not at all. You can access recordings of our webinars by visiting CNA's YouTube channel as well, and this will be posted This will be posted in the coming days as well, and that link will be sent to you. And that brings us to the end of our presentation. Thank you so much for your participation today, and I hope you have a wonderful day.